Hi, everyone. Thanks for tuning in to the vlog. The COVID-19 pandemic has changed the way that we do our work at AHS, but it has not stopped our work, especially major projects such as Connect Care. Connect Care is the bridge between information, healthcare teams, patients, and the future. Its foundation is a common clinical information system that allows healthcare providers a central access point to patient information, common clinical standards, and best healthcare. But it's so much more than that. Connect Care provides the entire healthcare team, including patients, with the best possible information throughout the care journey. Healthcare teams will have a more complete picture of a patient's health history, access to consistent information on best practices, resources at their fingertips, and will be able to communicate with patients and each other more easily. And thanks to the hard work of countless people, the first wave of Connect Care successfully launched at the University of Alberta campus and other sites in the Edmonton Zone on November 3rd, 2019. In fact, approximately 17,000 staff and physicians are using Connect Care every month. And with Wave 1 in place, Connect Care has been an important tool in our COVID-19 response. Its flexibility allowed us to adapt it to support the pandemic in a variety of ways. This included building COVID-19 order sets and tools to support care for COVID-19 patients and expanding virtual support for patients across Alberta Health Services. Our next wave is now set for October 24th. That's next Saturday, and will include suburban Edmonton sites, as well as the connected lab and diagnostic imaging locations. So joining me to tell us more about that and what we learned during Wave 1, we have Heather Dursling, Executive Director, Suburban Hospitals, Edmonton Zone, Judith Hockney, Senior Operating Officer, Royal Alexandra Hospital, Lois Hole Hospital for Women and Sturgeon Community Hospitals, Barb Cathal, Senior Program Officer, Connect Care, and Dr. Stuart Rosser, Interim Chief Medical Information Officer. So welcome to all of you, and thank you so much for joining me today. So Barb, we're going to start with you. Could you tell us a bit about some of the challenges we faced during Wave 1, which seemed like such a long time ago?
So there was many challenges with Wave 1, and I think one of the major ones was designing, testing, and validating a fully integrated provincial system within the timelines. And many of the project streams were quite behind schedule. I think this created a lot of downstream impacts for our operations teams, and lots of last-minute work was required. The collaboration and teamwork across the various groups and lots of hard work by everyone was the main reason we were able to successfully launch on time.
So Stuart, over to you. So coming off the heels of Wave 1, what would you say that we've learned that we can adapt for Wave 2?
I think what we've learned is that the content that we've created for the system is actually quite solid, but there's always an opportunity to adapt it to the unique special requirements of various ambulatory clinics and inpatient programs. And I think we've gotten a lot better at making those adaptations. I think we've also gotten better at explaining the difference to people about what truly is change management related to Connect Care and what is more provincial harmonization of processes that we probably should have been doing all along. And so I think we're better at representing that as well. And then finally, the thing that I've noticed most of all, and that other people have embraced, is our ability to work how we want, where we want, when we want, and to get the information that we need when we need it. That has been truly liberating with this Connect Care implementation, and I hope we can take advantage of that in Wave 2 as well.
So Heather and Judith, suburban Edmonton sites are part of Wave 2. Are there any differences in how each site prepares, and how are we getting our staff ready? So Heather, I'll start with you first, and then Judith, would like your thoughts on that.
So with Wave 2 launch, we have 7 different sites launching next week, and they range from really small sites with combined long-term care, acute, and then as large as Sturgeon, which of course we know is quite a bit more complex. So each of the sites have their own uniquenesses, and our implementation team and our Connect Care program team is working within the leadership teams of each of those sites to tailor that readiness activities to those sites. So there are some small differences. Overall, though, I think the Connect Care implementation, the standard implementation, where we've got a combination of both in classroom and online training for all of the different roles within Connect Care has been quite standard. We've got over 4,000 of our people trained within Connect Care, just ready for launch. And then, of course, there are the readiness activities such as the workflow dress rehearsals and the shadow charting, which are following the standard methodology, but of course, just those small uniquenesses for each site. And I think really worth mentioning today is that there are two new things, which obviously are different at different sites within Connect Care that we're launching that haven't been launched yet in Alberta Health Services. And we've got the labor and delivery module. So at Sturgeon and Fort Saskatchewan, those are completely new workflows for those groups, and long-term care at Devon and Westview. So the uniquenesses are really within the program areas at those sites.
So when I take a look at it, the differences that I've noticed has been, other than what Heather has just stated, actually is what support we have from Wave 1 and what we have support we're having from the future Wave 4. And I'll talk about it quickly around the tremendous support we have from those that went live in Wave 1. They're here to help us and support us through bench support and super users, that type of thing, to launch this wave. Plus, we also have the Wave 4 site, the Royal Alexandra Hospital, who is sending leadership support as well as frontline support and super users, so they can actually help Wave 2, but also learn anticipation for Wave 4. And I think that is very unique to this wave launch. And they're also supporting us in leadership-wise in the site command posts. So I think, other than what Heather said, that's what I'd like to offer. And that's quite exciting because we're still moving towards the future in Wave 4 with Wave 2.
Thanks, Heather and Judith. So Stuart, coming back to you, can you tell us a bit about super users and how important they've been in the rollout of Connect Care?
So super users are dedicated staff who are given additional training and experience with the system in order to be able to help out end users during an implementation wave. We found that they were very, very helpful in Wave 1. They were not only content experts, so they could sometimes answer your questions, but they were also process experts. If they didn't know what the answer was, they knew where to find it. And we're hoping to continue that with Wave 2. We've had about 9 special sessions over the past 3 or 4 weeks where we've taken learnings from Wave 1 and put them into 1-hour tutorials for our super users to get them up to speed on some pain points that they might encounter and be expected to deal with. I know that operations has been working very hard in this area too. It's not just the CMIO office that provides super users for at the elbow support. Finally, we'll be doing a lot of this virtually this time, and we've got some technology in place to allow us to share screens with end users and to talk them through processes, and we're all very much looking forward to using that.
Back to you, Barb. It's been close to a year since Wave 1 launched. So how are things working out and what successes have we seen?
There's been lots of successes for sure. I think Stuart referenced some of the mobility success, people having access to patient information at their fingertips. We heard one nurse say with the Rover, the small device, that she's got the patient chart in her pocket. Easy access to information, I think being able to communicate across the team very much easier and much more seamless within the patient record has really been a big success. I think with COVID, we are able to rapidly adapt the system to the constantly evolving evidence regarding COVID, adapting order sets and decision support guidance, rapidly adapting to the virtual visit strategy, both for ambulatory as well as inpatient visits. So we could, teams could stay connected to their patients with maintaining the COVID restrictions. And I think, I think that another big success, which I don't think has been highlighted, but is very important, is the use of the data from the system through COVID. We're, the clinical questions could be answered in terms of patient responses to therapies and other analysis that the data from the system provided. And lastly, but very importantly, is that our patients, we're seeing increased uptake of patient use of the My AHS Connect patient portal, and more effectively partnering with their healthcare team in managing their illness or their health. So I think, lots of successes, not the least of which has been our patients' involvement in their own care.
Judith, last question goes to you. What are you looking forward to most about having Connect Care at your sites?
So for me, as a senior operating officer, I'm always anxious and ready to adapt around the patient safety realm. And I believe one of the biggest benefits of all of this is patient safety. We know in patient safety that transitions in care, information is lost or can be lost. That can have significant impact on a patient. This system allows that to disappear when people are using it correctly. So for patient care and operating a huge hospital, to me, that's the biggest bonus. Now, taking a look at that, I think it will also increase the patient's confidence that we are getting the right information for them at the right time. So that's always a bonus. And the other thing when I talk about it, well, legible charting, never can forget that. It will have legible charting. And it will also create those flags that will prompt our healthcare professionals to look further than they may have thought that they need to do. So we're developing one right now about our vulnerable population that will have flags that we can incorporate the parts of their healthcare that are specific to them. So for patient safety, it is the biggest impact in frontline care.
Great. Thanks to all of you for coming on today, and thanks to everyone who's been involved with Connect Care. This is truly a transformational project that puts Albertans into the center of the healthcare team, improving care outcomes, and would not have been possible without the work of thousands of people behind the scenes and on the front lines. We know the road hasn't always been easy, especially with COVID-19, but you continue to persevere and move the work forward. So kudos. Connect Care has been a tremendous asset to AHS and the service we provide to Albertans. And I look forward to the rollout of Wave 2 and beyond. So thanks very much for watching. Good luck on the 24th, and I'll see you again next week.
Together, we do amazing things every day.